Warm greetings from Chennai to participants across India and the globe. Welcome to the 6th edition of Healthcare Insights, powered by RedMed and hosted by LBN Tech Solutions and All Ladies League. I am Meghalai Sendil Kumar and I head LBN Tech, a digital marketing company, and I am the host for this evening. Today's topic is back pain, myths and facts. Thanks to Sandhya and Jay Srinivasan of RedMed, we have had several eminent speakers gracing healthcare insights in the past. RedMed Health Systems is a connected health venture that has the goal of empowering people to lead healthy lives. You can know more about RedMed by visiting redmed.in, www.redmed.in. Access to accurate information is a basic human right. Public health depends on an informed public that is empowered to make the right decisions. We talk about disparities in health, but we talk less about health information inequality, which is disparity in access to credible info on health. So now people rely on social media to get the credible information. So with this aim in mind only, we started Healthcare Insights last year, and every month we have been having eminent speakers from the healthcare industry. And to bust the myths, especially surrounding the topic, and also to give accurate, credible information. We have two experts with us, Dr. Renu Dadiala and Dr. Swati Bhat. Welcome, doctors. A little bit about Dr. Renu. She is consultant and in charge medical services and operations, IPSC Bangalore faculty, IPSC varsity consultant, sports and musculoskeletal physician to KSRA, Karnataka State Rifle Association. Dr. Renu has been in the ex-Border Roads Organization, consultant physician, ex-MEG, Indian Army, consultant sports medicine physician. So happy to have you here, Dr. Renu. We also have Dr. Swati Bhat. She is a consultant pain and palliative care interventional spine specialist. She has established visiting training for nurses and junior doctors under CTC4 Cancer Treatment Center, program for a dedicated palliative care team for cancer and critically ill patients in collaboration with APHN. Performed minimally invasive pain interventions, academic head and trainer IPSC, trained and certified by the Government of India for telemedicine, trained in advanced spine interventions, vertebroplasty, biacuplasty, I hope I am pronouncing it right, intrathecal drug delivery systems. So happy to have you two accomplished eminent speakers here to discuss about the very, very common problem which people face, which is back pain. So participants, the moderated question answer session will be happening now. First, the questions will go to Dr. Renu, and then Dr. Swati. Then after the moderated Q&A session, the session will be open to you all, where you can type in your questions in the chat box, and your questions will be answered by the experts. So Renu.
Good evening, everyone. I'm Dr. Renu. I think Megha has introduced me, and I don't need to say anything more. And first of all, thank you so much, Megha and Sandhya and Jay, to have me and Swati on this platform. So without delaying it any further, so I mean, we all are going through this pandemic for over more than 1 year. And along with it, there are a million uncertainties and stresses that we have been dealing with. And what has been the part and parcel of this whole situation is the sedentary lifestyle. So I won't be surprised today if all of you sitting over there and watching and listening, that you have very many queries about, back pain, right? So without delaying any further, I'll just straight away I'll just give you a little bit background about back pain, and then we can address the questions. Is that okay, Megha?
Yes, yes. Please go ahead.
Okay, so I'm just going to take about 10 minutes of yours. So we all know that low back pain is a leading cause of disability worldwide, and it is extremely common in general population and amongst the sporting population. By any measure, it's the most costly musculoskeletal disorder in the industrial societies, and many people are afflicted once or more times in their lifespan with back pain, and then the pain remains for extended period of time. Statistics have shown that about 80% of the people, they develop low back pain in their lifetime, and majority improve over a period of 3 months. It's seen that about 5 to 10% of the people will end up developing the chronic low back pain, and majority of all these prolonged or chronic back problems are non-specific, which means that the cause of the problem cannot be determined by any kind of imaging, whatever, or we can say advanced MRI as well. So the fact is that during our lifetime, our spine, especially the lumbar spine and the cervical spine, it goes through repetitive loading during just activities like your regular activities of daily living, walking or lifting, or lifting any heavy weights or loads, or any other occupational activities. So now our spine can withstand such high demands of routine, that is this kind of a loading, due to its robustness of both the vertebrae, that is the bones when you run your fingers on the center of your back, that is your spine. So these are the bones, the vertebrae, and that makes the entire spine, and also the discs in between these vertebrae. So without going too much into the medical terms, let me just try and simplify it for you as much as possible. So the disc is a structure which is present in between the two bones, that is your vertebrae, and it is gelatinous in consistency. It's got a little bit of collagen, and it basically and proteins, and it helps. It maintains the hydrostatic pressure. It gives a nice cushioning in between the two bones, and also this is to resist the compression and maintain the separation of the two bones. Now also this disc, the gelatinous structure, it is surrounded by, like to put it in as lay terms as possible, it's a rim which is called annulus, and that is made up of collagen and elastic fibers, and that gives the elasticity to the disc. So if there's any kind of a sudden or abrupt loading of the spine, or it can cause an acute injury to any of these structures. So the forces which are applied to the spine during lifting, like any household work that you're doing, you're lifting, or or you're twisting, or if there's any kind of a sudden impact or any compressive strain on the intervertebral disc, that is a disc which is there between two vertebrae, and it can lead to eventually it can lead to the degeneration of the disc. And once the disc is degenerated, it becomes more susceptible to injury and lead to back pain. Now, the pain which is associated with the low back dysfunction arises from either chemical or mechanical irritation. So I won't go too much into it. So coming to mechanical irritation, it's basically from the whenever there's a mechanical loading, there's a stretching of the tissues such as ligaments or tendons or joint capsules and other structures, and compression of the spinal nerves happen because of the herniated disc once the disc gets damaged. So the pain can also be because of the local muscle spasms, the muscles which are supporting your entire spinal columns. All these muscles can go into spasm, and that can give rise to pain. And also there are joints over there, they're called facet joints. They can also cause a low back pain. Now, whatever it is the source, whatever causes your low back pain, it can be either felt locally in the lumbar region, that is your low back, or it may get referred to, you can feel it in your buttocks, and you can feel it in your lower legs, you can also feel it in your groin, right? So let's say there is no definitive cause. There's no definitive cause of your back pain that can be diagnosed with the traditional methods. Then the best way to alleviate pain or also to improve the function is to return to your activities, as early as normal as possible. And as a matter of fact, even if there's a specific cause of back pain, our aim is to make sure that our patients get back to their normal physical activity as early as possible. Now, when we say increase in the physical activity, it may be basically return to activities of daily living, such as walking, doing your domestic work, just doing your regular work. The main objective is to mitigate the fear of movement, because most of the patients we have seen, they have back pain, they come with all these symptoms, and they are just very scared to move. They don't want to move. So we encourage them to continue doing whatever little activity they can, and as normal as they can feel. Now, when we look at back pain, so it's based on the duration for how long you've had the back pain. So it can be acute or subacute, or it can be chronic. Now, to me, chronic term suggests an incurable condition. So which actually is is seldom the case with back problems, and the term, in my view, is directly misleading, and it tends to stigmatize the patient. The boundary between the acute, subacute, and the chronic problem to date, has been considered to be, around 3 months, and not really more than 3 months. So, however, there are growing indications that the term chronic, can or should be applied considerably earlier. The reason being that the changes that were previously considered to constitute and respectively define the transition to chronic back problems, can be observed much earlier than previously expected. So the major population studies, have shown that the back and the neck problems are characterized by frequent relapses over a period of time. So it won't be like, a lot of patients that we see is they say, I had pain 1 year back or 2 year back. And so there are, incidents where there is a, frequent, short-term, relapses that they have. So it is clear that the back and neck problems, they tend to become chronic if you ignore them. And most people have mild to moderate symptoms initially, and a typical progression appears to involve symptoms that fluctuate between, periods of, a few symptoms initially, and then periodic deterioration with relatively less problems. So they kind of let it go, on its own, and they kind of don't do much about it until it becomes, then they say, look, I have a chronic pain. So having said this, just a little bit of background about what I'm going to be talking. So we will go straight to the questions. So Megha, over to you. I think you have a set of questions that you need to address.
Yeah, thank you, doctor. So you've given us the anatomy and a little bit about the chronic pain, and people always feel, why is my back pain coming back, recurring? So we have the answer now. So that is common to have a relapse. That's what you said. So the causes, you said wear and tear is one. Can you pinpoint, a set of causes for the low back pain, particularly for low back pain?
Okay, so there are specific causes and non-specific, so or they're acute or acute, which we basically categorize into acute and the chronic. So there are many causes, like I said. So to treat a patient, it is very critical for us to understand that which structures are in the spine, they are generating the pain. So the pain-sensitive structures in the spine that cause pain are, the outer, so-called, like I mentioned, the annulus, that is the outer ring of the disc. It can be also facet joints, and it can also be the ligaments. It can be nerve fibers and muscles, as well as the fascia. So these are the pain-generating structures. So when someone has an acute back pain, so it means that there is an acute injury to any one of these structures, and it depends on the mechanism of the injury, how the injury has happened and the structures which has gotten involved in that injury, right? So our spine basically goes through compressive loads. It goes through flexion, that is, we bend forward, we bend backward, and there's a rotation. All that is happening, right? So lifting heavy loads, it puts compressive loads on the lumbar spine, making the disc vulnerable to disc prolapse and disc bulging. And when we bend forward, I mean, most of the activities in our day-to-day living, as well as at workplace or even in the industrial setup, it involves bending, right? So although prolonged, repeated forward bending may not load the spinal tissues to the point of fatigue or to a point of failure, but it can definitely greatly risk the disc injury, right? So occupations or the activities which involves repetitive flexion, that is forward bending of the spine, they reduce about 85% of stabilizing, you say stabilization reflex by a muscle which is very, very close to the spinal column, which we call as multifidus. So that exposes the disc to destabilizing injury, and the studies have shown that if one remains like it does an activity or stays in a bending forward like deeply, that deep flexion for about 20 minutes, then it takes about 30% of the slow steady destabilizing effect remains in the disc for about 50 minutes. Now you can imagine what 20 minutes of deep bending forward, what kind of a damage it can cause to the disc. That's why, when the patients come to us with low back pain, so first exercise I make them do is, okay, fine, if you have to pick up something from the floor, how do you bend forward? Or, how do you do activities, kind of standing, so-called bending forward, which is very, very important. I always tell them to keep the, lumbar spine, the low back straight and hinge themselves from the hip joint and also at the knee, so that your lumbar spine is not put through that kind of damage. Now the other one is the axial rotation, that we rotate the our low. We do a lot of movements which cause a lot of rotation at our so-called waist, and that can cause tearing of the annulus, which is the outer the rim of the disc. Then extension, which is the backward bending, right? So that may also cause injury to the facet joint. So the various structures, like I mentioned earlier, so all these movements. Now, I mean, it's not just that, just the bending forward or bending backward or just rotating the spine that leads to back pain. Most of the activities that we do, that requires combination of the movements. I've seen in my sportsmen, like sports like cricket and sports like golf, and it's not just extension, backward bending, there's also rotation happening. Same thing, a housewife working in the kitchen, sweeping or swabbing, or a person sitting on the chair in the office. So a spine goes through, lumbar spine goes through combination of these movements. So another interesting fact I must tell you, that disc as such, it does not have any blood supply. It does not also have any nerve supply, right? So whenever there's a disc damage to the disc, what happens is the disc material, I mean, it gets the outer rim, it gets disrupted. The disc material, it comes out, and it basically starts into the areas which are pain producing, the structures which are sensitive to pain, and that causes the pain, right? So now there are certain factors which do cause certain causes of your chronic low back pain, and that's the the calmness being, which is again degenerative, the calmness being spinal stenosis, of course, the medical term. So to explain it, or to make it as simple as possible, that is, over a long period of time, there are a lot of degenerative. There's a narrowing of the the spinal canal, because the the degenerative changes in the tissues that make up the joint system, between the two vertebrae, between the two bones. And so what the patient will normally have pain when he's walking, or in special certain positions, or extension, that is bending when they bend backwards. So all these positions, specific position, it causes pain, and that is they can aggravate and they can compress the nerves. So when patients have these kind of pains and it is over a prolonged period of time, it is time to see a doctor, and they should not kind of And another cause is spondylolisthesis. Again, I mean, I don't expect my listeners to understand the medical terms, but to put it as simply as possible, it is a condition which normally is a defect at the L5 vertebra. So what happens is, the entire vertebral column, the spine from L5 above, it just kind of shifts forward. It moves, it slips forward over the one sitting below, that is the S1 vertebra. And so we don't normally do anything unless the patient has symptoms. So, a lot of people do come with the, if you do an MRI, you see, okay, there is a listhesis, there's a little slippage, but it's less than 25%. There are no symptoms, you don't do anything about it. But if it's, more than 25% and patient has symptoms, then definitely, we do address that. And the symptoms that they commonly will have is, there's a low back pain, which is radiating down to the thighs, down to the knees, and all the way down to the to the, sometimes even to the foot. And it will also affect their walking pattern. And they may also have chronic pain because of a prolonged instability. And prolonged instability happens again because of the degeneration. The degeneration can happen between two bones, two vertebrae. Right. So, and when that happens, there may be degeneration, maybe in the form of, those osteoarthritis, extra tiny bone formation. And this leads to, again, either a forward or the backward, slipping of the vertebrae on one on top of the other. And this can, again, cause pain, during movements, and again, during sudden movements or in certain specific position. One can also have a chronic pain because of some kind of inflammatory disease. And in this kind of if somebody is having night pain, right, and the pain will be all along the spine, and the patient has a night pain and pain at rest also, then again it's time that they visit the doctor. And again, chronic pain can be because of the disc herniation. It is degenerated and it's come out, it's herniated, and it's causing pressure on nerve, single nerve root, or the more nerve roots, and the pressure on these nerves can cause pain. So I mean, I would like to mention that 2/3 of the normal adult population, they have no symptoms. It's funny. I mean, despite the disc hernias, they have a herniated disc, and that are seen on an MRI. And I mean, the studies show that if you do an MRI of the population in general, across the board, 90% of the people will have degenerated spine, and they will have, multiple levels, just, hernia, disc coming out, and, all that. But they are asymptomatic, so we don't do anything about it, right? Then the last but the least is the osteoporotic fractures. If they have a fracture because osteoporosis in the vertebra there's a fracture, and it reduces the quality of the life of a person, and the pain is excruciating, and it's the typical thing is that the pain would have been there for about a year or so. So these are the chronic causes for the back. Yeah.
So I think mindfulness is needed whenever you bend forward or bend backwards, or some people stretch from the car, they take something from the back seat, and then there is a problem in your shoulders. So I think mindfulness is a must.
Mindfulness, yes,
you've listed a number of causes for the back pain, but thankfully, like you said, all don't require much of treatment. Right? So that's a nice heartening thing to hear. And some people, you were talking about radiating pain, which reminds me that some people tell that there is a radiating pain which goes down my thigh. I've heard some people say that. Is this called sciatica? What is sciatica? Is this
Sciatica is an irritation or inflammation of the sciatic nerve, which happens to be one of the thickest nerve in our body, and that normally gets compressed by a herniated disc, the disc which has come out in the lumbar spine. So it causes low back pain and buttock pain and the shooting pain, which goes all along this leg. So that's the sciatica.
That is sciatica. Okay.
Yeah.
So we have exercises for that for treatment for sciatica.
Yes, I mean, there is a treatment for that. Yeah.
Very good. Okay. You were mentioning that some people don't even need an MRI or X-ray for diagnosis.
Yeah.
So a person who comes in for back pain, just a physical examination will do, or some people do further investigations to find out what exactly is wrong. I mean, do all patients require MRI or X-ray?
Yeah, so the diagnostic tests are done only when the diagnosis is unclear, and a specific test can give an important information of the cause of the pain. That's when it's done. So let's say that the doctor knows the diagnosis, but by doing the test will definitely change how the course of the treatment, how the patient needs to be managed, right? Let's, for example, a patient with a low back pain has got a radiating pain down his leg and the foot, is getting better with appropriate medication or treatment. He may not require imaging or testing. Whereas, the same patient, if he's not getting better with the current treatment and need imaging to determine if the surgical or any kind of a pain intervention is required, then of course, we would ask. So radiological, let me put it this way, radiological findings do not equal the pain. I mean, that's how I would like to say. It's only, we do it to just see how we're going to manage the patient, and
Okay, for further, and just to see how much more damage is there, and for further diagnosis and treatment, probably, right? So you were talking about slip disc, which is commonly used, or herniated disc. So you think surgery is needed for such a condition, or just a palliative treatment and medication will do for herniated disc treatment?
For a herniated disc, surgery, certainly not. Surgery is really not needed. Okay, again, depends. But most herniated discs, they can be treated non-surgically, and the symptoms resolve almost completely. Conservative treatment, how we can approach the patient is, of course, restriction of the activity, but definitely not bed rest. And anti-inflammatory medication can be given. Physical therapy, that is exercises, basically to decrease the pain and improve mobility, as well as the strength of the back and of the strength of the lower limbs. There are injections, intervention pain procedures, which are brilliant, and that, like I say, it can resolve the symptoms almost completely. And of course, education to the patient to prevent any kind of a further injury is very, very important.
Yeah, awareness, education is so important. I agree with you. Some people are, they are in the pink of health all the time. They don't feel any aches or pains. But some people tend to suffer so much with back pain or some other pain. So who are the people more prone for back pain? Who do you think?
So people, who do very heavy work, they have very heavy work demands, or people, with a sedentary lifestyles. So low back pain normally results from excessive loading on the normal back, or a normal load on a very weak back.
Yeah.
You understand the difference. Or another thing is, or a back which is unprepared, like people who are fit and, in the sense, there's a sudden kind of, they are unprepared, and they are subjected, to some sort of, sudden activity, and which is where they have to, let's say, lift something very heavy. And so they also can,
have these aches and pains.
Absolutely.
Okay.
So in terms of sports, I mean, I deal with a lot of athletes. In terms of sports, athletes in sports, they like sports like golf, like cricket, baseball, or bowling. They're the most likely activities that can cause lumbar disc problems. And again, because of the combined movements that they have, even though, I mean, these are fit guys, you know, they are so-called conditioned guys, but it's just the combined movements. It could be, you know, the wrong technique, or, you know, the coaching style is not okay, and they're just biomechanically, they are not, stable. Okay. So these are the people, you know, who go through, I mean, who tend to get low back pain.
Yeah. Maybe occupational hazards also. I've heard of some dentists, because they have to bend over and do some activity. So Absolutely. They do get some back pain yes. Occupationally. That is a problem. And what about obesity? Obesity is obesity a factor for back pain?
Yes, yes, absolutely. And also, I mean, interestingly, industrial factors that, that could cause back pain, maybe the job, low job satisfaction. Funnily, I mean, I was, or a very monotonous or a repetitive work, or a poor employee, employer appraisal, or, recent unemployment, or the person is unhappy at job or with the employer. All these factors, they all contribute to low back pain. Yes, absolutely.
Yeah. So, okay, that is for people who work, but there are some people, the one set of people like pregnant women. Now, pregnancy, these COVID times itself is very complicated and very stressful. And one common complaint which pregnant women, apart from many others, is spike in sugar levels, apart from low back pain. Low back pain seems to be a common one which pregnant women face. So why do they get low back pain, pregnant women?
Yes, the back pain in pregnancy is basically related to the posture, as the uterus becomes an abdominal organ. Once it comes into the abdomen, the uterus, it's all the weight is in the front. So there is a shift of center of gravity in a pregnant mother. Yeah. And if they have, they at the pre-pregnancy, fitness levels are not great, and they are obese, or they are very thin, their back is very weak, it is definitely going to load their lumbar spine, because the spinal curvature in the lumbar area is going to change. Okay. It becomes more curved, right? Okay. And also the positioning of the baby, as the baby grows in size, the baby against the nerve roots in the lumbar and the sacral region, that is also going to give rise to the low back pain. But it's not pathological. It's more of, I would say, unless, yes, we evaluate the disc prolapse or something has happened, she's damaged her spine unknowingly, whatever. But this is very, very normal in all pregnant mothers, that is the lumbar spine, it undergoes a change in curvature, it gets exaggerated and it gets loaded more. So during pregnancy also the levels of the hormones are, very, very high, and, relaxin hormone levels are very, very high. And these particular hormones, what they do is they cause a laxity of all the ligaments which holds the pelvis of the mother. That is to accommodate the pelvis for the baby when it has to come down towards the end, for her to deliver the baby. Right, so all these factors, the ligaments become more lax, and and the mother is completely unaware and what is happening to her, and all these things give rise to the low back pain. And the best thing for this thing, and this kind of a low back pain can be resolved very easily by embarking on a sort of an exercise program for the back right from the beginning of the pregnancy, and that actually keeps them fit.
Yeah. So you talked about this chronic pain, but some people may wonder when to see a doctor. I mean, it's just ordinary back pain. Will it just go away with exercise, or do I have something really serious? And, what is the difference between a regular back pain and what are the serious causes of back pain? I think participants might want to know.
It is often very difficult to distinguish benign, that means which is something which is not harmful, from a malignant cause of the low back pain. The low back pain which is related to the musculoskeletal causes, that is, it normally resolves in a very short period of time. And in fact, 90% of the back pain episodes resolve in about 4 to 12 weeks, right? So when the back pain is really not improving at a rate that approximates this time frame of 4 to 12 weeks, we need to think of the other possible causes. If one has unrelenting pain that is not changed by change in position or with rest, that's the time when they really need to go, see a doctor. If one is getting night pain, pain at rest, they need to see a doctor. Or pain that increases when they lie down, then again, one very strong reason to see a doctor. Or pain which is associated with fever or chills, time to see a doctor. And it should be evaluated for spinal infections. It should be evaluated for any tumors, that is cancers. It should be evaluated for tuberculosis. It should be also evaluated for kidney infections.
Okay. I think that's a good explanation. Now we know that when to see a doctor, when you are at rest, if you have pain, nighttime, if you have pain, and it goes beyond 6 to 12 weeks, then it's time to see a doctor. So exercise, we all know it is really important, and there are a whole lot of exercises. So what are the type of exercises you recommend for low back pain? Yeah.
So I would say no single group of exercise is right for everyone, despite the fact the handout says, which is handed out to you in the outpatient of your doctor's your clinic or the hospital. So we certainly know that the exercise in general are very important in any rehabilitation program of low back pain. In fact, after undergoing an intervention for the pain, also very, very important that they strengthen their back, as well as they maintain the flexibility of the back. Extremely important, right? It is also established that people who are in the sense who are more fit, they have less low back pain. And also, if they do get low back pain, they bounce back faster. Yes, okay. Exactly. The pain tend to resolve much faster. So exercise does have a protective effect in terms of maintaining strength of the spine and the spinal segments, and also in terms of providing nutrition to the AVF. Like I said, I mentioned earlier that the discs do not have a blood supply. They don't have a nerve supply of their own. And simple exercises like a lot of people do yoga, right? Okay, so Westerners give nice terms to that. It's just a simple camel and cat posture. That flexion and extension. Yeah, exactly. Just that particular exercise, what it does is this is a pumping kind of an action. So it opens up the space, intervertebral, space between the two things, and then it just keeps pumping in more, oxygen and blood supply to the disc and keeping the area absolutely healthy. So in fact, I do tell my patients that even if they have back pain and it's not radiating, just so they come with a initial episode of back pain with no radiation, nothing. It could be because stiff muscles or whatever. So I just tell them, just start off very gently, start off with cat and camel, and stay within your own comfort zone, and it'll just, you're basically giving
that's right. So I think once you get used to exercise, you cannot stop exercising. One day if you miss, you feel bad that you have not done your exercise. So participants, I hope you have got that. Those who have not exercising, please start today. And people say sitting is the new smoking. So sedentary life is one of the causes which doctor has already told. And thank you, doctor. And I think very, very well explained. And we'll go to the question answer session with Dr. Swati now.
Thank you so much.
Thank you so much, Dr. Renu. We'll have you back for the audience questions, where you can answer the audience questions.
Absolutely.
We've already started typing, but we will deal that after I talk to Dr. Swati.
Yeah.
Welcome, Dr. Swati.
Thank you so much. First of all, I'd like to thank you for having me over here, for having invited me. I'm highly honored. And it's been really great hearing Dr. Renu and your conversation. I think she's already addressed most of the questions that I would have. if there's anything left, probably
So there are lots of questions left, and I'm sure the audience also has a lot of questions. So Dr. Swati, nice to have you here. Welcome, welcome. Probably I can start with the questions which I have for you.
Yeah, sure.
Yeah, good to go. Okay. Some people say that one should tolerate pain till it becomes severe and don't take medication. Okay, is that advisable, or are medications really harmful and we should avoid them? What do you think about medication? Should we wait till till it is unbearable and then start the painkillers?
See, these are really two myths that the society has been wound into for a long period of time. There are actually two questions. You really interestingly asked me these. One being whether we should actually tolerate pain for a longer period of time before it really gets severe, or even tolerate it till that period, which is actually a wrong concept. For years or generations, people have been really thinking that pain is a yardstick of your tolerance or your endurance, which is totally a myth. It is not. Nevertheless, the earlier you treat pain, the better results you have and the lesser propensity for it to become chronic. So the chronicity is reduced.
Yeah.
Right?
Yeah.
So a pain episode, when it reoccurs over a period of time, it goes into chronicity, and that is when it becomes a disease of its own, right? So it changes its course from being just an acute protective phase, which it subserves, which we all have a natural defense mechanism in the body. But when it's there in the body for a prolonged period of time, and it's not treated or taken care of, it becomes chronic, and that is much worse and much difficult to treat. So the crux of it becomes a neuropathic kind of pain.
Okay.
The crux of the whole thing is that you must relieve pain as early as possible.
Okay.
Do not really go on and bear it.
That is one big myth busted, Dr. Swati, because we get a lot of information all over social media saying that do not take these painkillers. But what you're suggesting is please take it, because otherwise it becomes untreatable. So you prolong the pain.
And plus when you treat the pain at an earlier stage, your thresholds are not the same as they will be when it becomes chronic stage. So your requirements of medications over the period of time increase much more. There are multiple medications which will have to be put, the side effects of all of that. So it's much earlier. The treatment is much better. You can use probably a simple medication as simple as a paracetamol, a little dose of an opioid, mix it with your exercise, daily routine, follow healthy practices to stay upright, take care of your spine well, good health. So I think that all will come handy, and they work together to avoid going into that chronicity, and it works rather better.
Yes.
Having come to that, you mentioned about questions. You mentioned about whether medications should be taken or not.
Yeah.
Well, medications do, many of the medications do have their side effects if they are taken over a prolonged period of time. Or some of the medications like the non-steroidal anti-inflammatory medications, yes, in susceptible individuals, even single doses can cause renal failures or an acute kidney injury. So that, barring those, the other medications are okay to take. Steroids have their own side effects. I'll not go into too many of them, but osteoporosis, endocrine side effects, all of those. So at best, it's better to use less doses of steroids. So the ideal way of using them would be deliver them or give them in a targeted manner. So lesser doses delivered at exactly the spot or target where the inflammation is would be a best thing that we can achieve the target specific interventions or minimally invasive interventions. We can avoid giving huge doses of oral steroids. The rest of the medications, as I mentioned, paracetamol, and there are other medications, a lot of groups of medications which we call as co-analgesics, which work on your inhibitory system in the spine. So those medications are always okay to use if required for a neuropathic kind of a pain. We use anticonvulsants, antidepressants. They have their own role in pain management.
Yeah.
So it's okay.
Also, Probably one important thing to note is follow the doctor's prescription. If it says 10 days, it's only for 10 days, right? Sometimes old prescriptions come back with the same pain comes. So the prescription comes back and more is taken, which is not
Yes,
right.
self-medication and even prescribing it to others. That's also one of
Yes.
so
Yes, terrible thing
instead
that
of
is.
saying,
Yeah.
like I have back pain and I was advised this by a doctor, so somebody else in the family or a friend comes up with back pain, so hey, I have a prescription, and you start following and you start sending it on WhatsApp and everywhere, and that's
Terrible.
not how,
Yes.
that's not how it should be done.
Yeah.
Everybody
That's a very bad thing, because we don't know their underlying condition, which might be harmful. This medication might be harmful to them. That is also being done by certain people. I hope that will be avoided. So right now we are all facing the pandemic, and we all know that COVID patients, suffer from back pain. So back pain seems to be there for several days, even after the virus has left the body. So how has COVID affected the people in terms of their spine health, and what can COVID patients do to avoid this back pain?
See, let's address this as a general rule over all the masses, whether a patient is COVID or non-COVID. How COVID has affected a general population is known to all of us. It's really brought down restriction, or it's really brought down the availability of any individual to be going for regular walks or gym or exercises. It's really, and even going out to work has become very, very limited. So people who are working from home, staying home entire day, sitting up or in their couch or bed, not following the best practices to, while they're at work, working with computers, watching television, mobiles in odd angles, which is not really ergonomic to your spine.
Yeah.
So all this has really affected the health of the spine, and it has increased the incidence of back pains tremendously. Not only in the elderly population, but even in the youngsters, the incidence of back pain has really, really increased. Children, imagine the kids who would be going to school, college, all activities, who would be bubbling with energy. They're all restricted. They're all at home. So all these, the pediatric incidence or the adolescence incidence of back pain also seems to have been increasing tremendously. So it has really affected. COVID has not it has not left any age group untouched in terms of back pain health. So I think the measures or the message that should go across to everybody is, wherever you are, try and get yourself as best. You can do simple exercises at home. So have a small little regimen of your own, say 10 minutes of an exercise in the morning and evening, just the stretches or a jogging or cycling. That all would really come very handy and maintain a good health. As far as COVID patients are concerned, and of course, as I mentioned, ergonomic sitting is very, very important. So whenever you're sitting, whenever you're doing your work, you're at your desktop, people especially who are working from home, so whenever you're working, make sure, as Dr. Renu already mentioned, that this doesn't have a supply of its own, it doesn't have a blood supply of its own. So it all depends upon the nutrition, depends basically upon the nutrition that is, it derives from the blood through a pressure gradient, which is only developed when you move. So it's very easily understandable. The less of your movement, the less you move your spine, the more you sit, or the more you sit on the chair, it's going to really hamper, or it's going to dampen this circulation. So if you don't give any nutrition to the disc, definitely there will be disc degenerative changes. So the best thing is, get up and take a walk every 40 minutes, every 30 minutes. Just stretch yourself up, and you could just go have a glass of water and come back, or just stand up and stretch yourself a while, and then get back to your work. Do not lie down and watch your computer or mobile, and do all of those things which are not they are not the things which are good for your health.
Yes, that is something which the general population does, COVID or no COVID. Lying down and watching the mobile, as well as the the neck, you bend forward to look at the mobile, which really hurts your neck also. Yeah.
What
Yeah.
brings about all the degenerative changes and stuff.
Yes. So, working from home also, people tend to, sit and eat all the junk food, and that affects your body. Generally, it affects the body. So apart from sedentary lifestyle, the junk food which you take, and the lockdown which keeps you at home. So all these factors put together, which affects your back. So I think Dr. Swati has given a lot of reasons for us to get up and move. So I think after this webinar, all of us should be going out for walks. I mean, at least to your apartment, because there is a lockdown in Chennai and other places too. So people tuning in from other parts of the world, if you can, then I think we should go out and walk. So
yeah. Exercises like Surya Namaskar.
Yeah, simple exercises.
It's got a brilliant role to
Yeah.
play. When you come to back pain and all, so it maintains your spine in a very good health. So just 10 minutes of exercise in the morning in your veranda or somewhere, it's great.
That's great. Yes, it really helps and keeps you fresh throughout the day too. So there are certain conditions, Dr. Swati, which need surgical treatment. Which are those conditions which actually need surgery for back?
I would see there are many multiple conditions that would require surgery. Not to enumerate those, I would rather concentrate on those that would not require, or those conditions exactly we should move from medication to the surgery. So broadly speaking, what contributes to your back pain, the majority of causes, or what are the leading causes for this, are, as Dr. Renu already mentioned, the small joints, which are the single units of movement in your spine. They are the facet joints, right? So these joints can become degenerated over a period of time. Out of many conditions. So if that happens, these can be a significant cause, and it's seen about like from around 15% to 30% times these small joint or these facet joints can be a source of pain. Leading to patients who are walking into your clinic with a back pain. So this may not require exactly any intervention, surgical intervention at all. This can be totally treated with exercises, small short of or small duration of rest, and followed with medications. If that does not work well, we can straight away ahead for interventions. So you can just probably see your interventionist or the pain physician after undergoing an examination, clinical examination, and of course your history, whatever. Once it comes to a diagnosis of this, you can go ahead and it can be safely relieved with interventions like a facet joint injection, whether it's inside the joint, or we require a degenerative process for it, which could give a longer lasting relief. That's one of the conditions. So the other conditions, which is very common, slightly in the elderly population, and even in pregnant women or postpartum women, especially in the beginning years after your delivery, which is the SI joint. It could be a single joint involvement, and many times it is both sides which is involved. So these patients also contribute significantly to back pains, or patients who walk into your clinic with back pains. So these patients also would not require an surgery right in the beginning. You can treat these patients also with exercises, as well as with minimally invasive intervention like depositing a steroid injection with local anesthetic within the sacroiliac joint. So it's basically the joint which gets dysfunctional over here. So these are talking. So the commoner causes that help and that lead to back pain. The other common reason for contributing to your back pain is the intradiscal degeneration, or the this degenerative disease that we cause, and this has a really high prevalence in the youngsters or the younger population. You would not see, unlike the SI joint or other facet joints, you would not see this in the elderly, but the youngsters. basically what happens here is, again, going back to continuing what Dr. Renu already mentioned about the disc. So this disc is something which is very fluidic, and it's quite gelatinous, and this provides a lot of complex flexibility to the spine when you move, or when you flex forward or backwards. So
Okay.
as this degeneration, as this disc becomes dehydrated, as if the water drains out, or this disc becomes drier and somehow it starts breaking in itself,
Yeah.
that is the condition what is called as the disc degenerative disease. And this happens most often when we are sitting in one position, or we are standing for a longer duration of time. That is what hampers the nutrition to the disc, and that can lead to significant pain.
Pain. Okay.
This is another cause. This is another leading cause. So for this, again, we have minimally invasive interventions. We can do a bicoplasty for this, wherein, let's see, the disc also has a supply of nerve fibers in the outer annulus, not in the inside, but the outer, which makes it very painful. So we can, so this innervation can be, we can denerve it, and we can do a neuromodulation for this, resulting out of which the patient does not feel pain. So this is again another minimally invasive intervention that can be done for this, and a significant amount of population can benefit from this procedure without having to go for a surgery. Unlike other conditions, or if the patient just straight away goes to a surgeon, may land up with a surgery of the same. So before you go on for any of this, if you come to an intervention pain specialist, we will examine you by a set of investigations, clinical examinations put forth together. What we do specifically in intervention pain is we do diagnostic blocks, wherein we give a diagnostic injection with a local anesthetic, which is totally reversible and stays for a very short period of time.
Yeah.
So the approach here is very different. We target specifically because there are many parts in the spine that could result into a pain. So before we jump onto a surgery, we really need to be very, very sure whether it is real cause of your pain, whether that is what is contributing to your pain or not. So that is what we check when we give a target specific intervention, or when we do a diagnostic block. So if it is a facet, we do a diagnostic facet block. Maybe or may not be the correct diagnosis, but only when we do it, we can come to the diagnosis that yes, this is the facet joint which is involved. So we go ahead and plan for the procedure like that. Unlike, just making a raw guess that it could be the facet and go ahead and do a surgery for that. So that is the other thing. And the other main cause, the fourth main cause, is the disc herniations. Once beyond a certain limit of disc degeneration, this nucleus pulposus, which is the innermost part of the disc, herniates and comes out, and then it compresses upon a nerve, where it causes either a chemical irritation of the nerve, or it can also lead to a mechanical irritation of this nerve, which sends down the nerve tremendous pain. These are ectopics. These are like thunderclap pains, which sends down rocking sensations down to the legs. So this is another leading cause of back pain.
Okay. So that very well explained, Dr. Swati. I mean, I think a very clear picture of when surgery should be resorted to as a last resort, like you said, after the diagnostic block. And
another important thing is when surgery is required, we need to really ascertain, or we need to be very vigilant. Whether this patient could be a possible candidate for early or emergent surgery. So we need to rule out something which is called as the red flag signs of back pain. So these red flags are your tumor, infection, any fracture, any ongoing sensory loss, which means there is progressive sensory loss. It could be the patient not feeling or numbness in part of a leg, which is increasing over the period of time, maybe over a period of span of few hours or days. Another is the motor loss or progressive motor loss, wherein the patient is not able to move a particular part, and the difficulty level may keep on increasing over the period of time. That is also when you should be alarmed at. This is also one of your red flag signs. And the other one is of course, your bowel and bladder involvement, which means an incontinent bladder, or difficulty to eject the pass motions. That is something which is like very, very urgent, and it needs emergency address. So you get an MRI done urgently, and then if there is significant involvement, you need an urgent surgery for it. Leaving aside these, the other causes can be looked into, and they require or they should mandate a medication course. If it doesn't work, go for an intervention.
Okay.
Go ahead with that, and then see if it works for you.
So we'll have to go through the course and finally decide. Okay. You were talking about minimally invasive surgery. You are a specialist in that also. How beneficial it is for the patient? Minimally invasive, hospital stays less, and recovery is faster, or is there anything more to minimum? And of course, the cost also. Can you just throw some light on that?
Yeah, interventions are actually the way going forward in the healthcare industry. They have their own benefits. As you mentioned, less duration in the hospital. So how does it actually interplay with the health of the patient? When you stay inside the hospitals, there is a risk of hospital-acquired infections, right? So you avoid all of that. The lesser duration of stay inside the hospital, especially with let's come back to COVID as well. So nobody wants to go into the hospital nowadays. So you minimize the risk of staying inside the hospital. The other advantage, there's no or minimal incision at all. There's no blood loss at all. So the tearing of these muscles, ligaments, they do need some amount of time to regenerate and get into the previous state. So which is like 4 to 8 weeks time, which needs which after the surgery person needs to heal all of these, which you totally bypass when you're going through a minimally invasive technique. More than that, when a patient is bedridden, or when a patient is in convalescence period after a surgery, there's a lot of risks that come with it. There's a risk of deep vein thrombosis. There's risk of embolisms. You avoid all of that. There's risk of atelectasis of the lung. You avoid all these complications. The risk of there's avoidance totally of anesthesia is another risk as such, which we need to evaluate when we are taking patients for surgeries who have comorbidities. So all of this can be avoided with minimally invasive techniques, which we do totally under local anesthesia. It's just done as a daycare procedure. The patient can come and walk out of the hospital the same day. So there are a lot of benefits besides the financial benefit.
Besides the financial, the recovery is also faster. Okay. Can vertebral fractures, what if a person gets involved in an automobile accident and if there is a vertebral fracture? So intervention techniques work for that also?
Yes, intervention, we have, that's actually a very good question that you asked me. Vertebral fractures can now be, sorry.
No problem.
So vertebral fractures can now be treated with minimally invasive techniques, and this is done as a single needle technique or twin needle technique. We can address as wherein we just go from the facet and we just go through the pedicle. We reach the inside of the vertebral body. We first do all the scans and get our fracture in place. We visualize how the fracture is. Of course, there are certain things which we need to rule out before we go for an intervention, a minimally invasive thing, which is the intact posterior column. So if the cortex is intact, we can go ahead and do it totally minimally in this technique. It's a single time injection of the cement inside, and it's all done under fluoroscopy. So you're continuously monitoring how you are injecting the cement. Again, the benefit is the same. You don't cut the muscles, ligaments, skin. You don't have any blood loss at all. Okay. So it can be totally addressed in a single needle technique.
Oh, that's great. Okay, thank you, Dr. Swati. I think we have a whole lot of questions. We can go in for the audience questions now. And Venkat, can you have Dr. Renu on the spotlight also, please? While I just go through the questions, we have a question from Sharmista Roy. Osteoporosis, about osteoporosis. Are exercises recommended for persons having osteoporosis? That's the question she has. And I think one of you can answer.
Certainly, yes. I mean, people with osteoporosis, they must do, weight-bearing exercises and exercises. They can go for walks and they can go for gentle jogs and all. They can definitely have, a very normal kind of a physical activity routine, but only thing that they need to be very careful about is their stability, because falls and all can lead to fractures. So yes, lower body strengthening and doing stability exercise, it really helps, but there's no contraindication to exercises for osteoporosis.
Okay, thank you. We have a question from SV Pati. Ice bag massaging or hot bag massaging? When to use ice or heat? That is the, kind of question people ask usually. I think it matters, right? When to use the hot pack and when to use the ice pack.
Yes, it does. It does matter. As a sports medicine physician, I would say it's always, if there's an acute injury, it's always icing. It's always cryo. That's what we insist. And we don't really use heat. Yes, unless if it's a chronic pain and which is 2-3 years and, very long. Yes, it can, you can use a heating pad, but it's always in an acute injury, any sort of a muscle strain or, muscle injury or any even joint also acute injury, it's always cryo. Cryo is always superior as compared to the, I mean, I have a lot of patients who come with, things, like they have a plantar fasciitis and the doctors recommend use a hot pack, which is a very wrong thing to say, which is a very, very wrong thing to do. There's an inflammation, in the plantar fascia, and you use a heat pad or heat, soak your feet in the, this is a simple example I'm giving, they say put salt in the hot water and soak your feet. So what happens is it's very psychological. The heat is going to give you that, that psychological kind of a comfort, but what it does is it encourages inflammation. It there's a lot of blood supply happening over there. Blood rushes to that area. So so it kind of flares it up. It's always in ice, because ice works in two ways. One, it is going to cause vasoconstriction, reduce the blood supply over there. It's going to wash out all the inflammation from there, and at the same time, it's going to have an analgesic effect.
Okay.
So, yes.
Very important question that is. Thanks, Pati. He's a regular here for Healthcare Insights, and thanks for the question. And we have a question from Maithili. Working for hours together on a laptop, will it in the long run cause this back pain, even if not heavy? I think she says that heavy loads are not lifted. And use of Bengay, is it to be avoided, or can we use? She has a question.
Swati?
Swati, you're muted.
Yeah.
Swati, you're muted. Okay, can you?
Yeah.
Thank you.
So I think I already answered that question previously while in my talk. Any amount, as I mentioned, even if you're like a few hours on the computer or laptop, it does pose a threat to your disc, right? So I mentioned the role of, or the importance of ways. Sitting is very, very. The right posture is really very important for you. Yeah, and the second thing is, as I mentioned again and again, the importance cannot be, mentioned more than what I've already, Dr. Renu and I have been repeatedly telling. It's very, very important for your disc to get the nutritional supply, and it depends upon the more the movement is there, right?
Yeah.
So to avoid you to avoid being sedentary for a prolonged period of time, not more than 30 to 45 minutes. That is the duration at which you can look at significantly sitting comfortably. Yeah. Beyond, you always need to get up and get some movement.
Exercise. Yeah. A question from Aparna Mahesh. I see my patients complaining of back pain due to severe constipation. Is this true? Back pain due to constipation?
It can cause, I mean, if it's a chronic constipation and there's a hard fecal matter in the rectum, it can cause back pain. But then, one needs to rule out the factors why the patient has constipation. And I think it should basically be addressed towards, treating the constipation and, helping the patient get relieved of his back pain. Swati, you want to add anything? And of course, yeah.
Yeah, as Dr. Renu already mentioned, you need to, when you're looking at constipation, there could be other reasons as well in the pelvic organs which need an assessment, which could also be causing the back pain. So when you're seeing anything like this, a pelvic involvement, you need to do an assessment for anything, whether it is a male or a female patient. You need to do a full assessment for this. And if all the other causes are ruled out, or if you feel that there is a significant cause, like there could be proctitis, there could be other reasons, there could be endometriosis, all of these need to be really ascertained, because all of these can present also with constipation. So there could be other conditions also which could be a contributing factor, and this could be just one of the reasons that you are seeing. Nevertheless, isolated or only constipation can also be a significant cause of back pain.
Okay.
And you need to rule out malignancy and all that, in that case. And
yeah, there might be some malignancy, right? So, okay. So time to see the doctor and rule out. So yes. There is a question here about work. Yeah. Tell me, Dr. Swati.
Yeah. So I work with a cancer hospital. So I do most of my work revolves around working for cancer pain. I've seen a significant amount of patients that come into my clinic saying that now they are suffering from or diagnosed with a cancer, and that could be anything, whether it's a bowel cancer or it's a pancreatic cancer or it is any other cancer, breast cancer involved. And patients would come, how they would be diagnosed, or the first incidence that they come to know about this whole thing is with a back pain. The patient went for a back pain to somebody, or did not take adequate attention, did not pay adequate attention. It's been there for a long, prolonged period of time. And then, by the time they land up with a physician and go through the checkups and everything, it's quite, the metastasis has already happened. So what I'm trying to say is back pain can be an alarming thing. So never ignore it.
Yeah.
Right? So there's a significant population that I treat, and, back pain can only be one symptom. Cancer is a very hidden disease. It does not present itself very openly right in the beginning. So the first alarm that you get, any pain, any back pain, which is not going after a period of rest with medications, it keeps on coming back and forth. You need to be vigilant about it. Nowadays, the incidence of cancer is very high. So go ahead, get yourself evaluated, investigated. Do not take it lightly. If it turns out to be negative, well and good. You are good.
Yes, I think that applies for tuberculosis also. Yes. Because I know of a patient who had acetabular TB of the hip, but there was no pain in the back or the hip, but the pain was a referred pain in the thigh. So it was a complete misleading. So I suppose any sort of pain which is uncommon, which comes, it has to be investigated as per your advice, right? So one question here, which is about workout. If there is a pain after workout, if there is no pain after a workout, is the workout ineffective? Should we have a pain after every workout?
No, pain is not a determinant of good workout or not.
Yes, that's a big myth busted right away. Yes.
I think most of the people who go to gyms, and this is I think one of the myths that the gym trainers most of the times they tell the people who are like into serious workouts and all, if you really did not have pain, muscle soreness, if it's not there, you've not adequately worked out your muscle.
Yeah.
Because that's not the truth.
Yeah. There is a question from Sandhya actually. Super senior citizens having back pain, they find that bending forward helps relieve the pain. However, that can cause the permanent change in posture, that is, a hunch. they are not able to exercise, how can they manage, if they are not able to exercise, how can they manage the back pain? She's talking about probably 80-year-olds, 75 and above.
See, the peculiar thing that
Yeah, we can hear you.
yeah. So the peculiar thing that you mentioned here is sometimes they get relief of back pain when they bend forward.
Bend forwards.
Yes, that happens quite often when it is the posterior longitudinal ligament that you're looking at that becomes lax over a period of time, and sometimes it bulges inside, and that is when it creates the pain. So when you bend forward, this gets stretched and it moves out. So immediately it relieves the pain. So when such a thing is happening, that is the time when you should really think about an MRI and get yourself evaluated very fast.
Yes.
So other part of the question?
The exercise, how can they manage the exercise? If they're not able to exercise, how can they manage the back pain? That is the question she had. Because they are quite old, they cannot exercise too much. So how to manage the pain?
Yeah, just getting up and walking, and that itself is a good amount of exercise for them. So they should not be sitting all the time. But see, what happens with aging is there's a degenerative changes happening in the joints, degenerative changes happening in the muscles. So the muscles they lose, they become stiffer. So it puts a lot of strain. I mean, it's what I tell people is they start yanking your joints, right? So what happens is you get into a vicious circle that I can't walk or I can't do this because my joints pain, or I can't walk straight. But unless you do that, you're not going to get flexibility of your muscles, some sort of a workout. So for that particular age group, walking few steps, even with the help of someone, or encouraging them to walk with their back straight, keep their posture right, that itself is a good amount of exercise. They can do that in the house from one corner to the other. They should not sit for a very long time. But then if the pain is quite a bit, what Dr. Swati said is that it has to be evaluated. But yes, exercise, I feel exercise should be there for every age group, even for a 90-year-old person. It is very, very important, because the muscles become stiff, and you kind of, you get into a kind of posture, they start bending forward because the muscles are stiff. There's a shortening of the muscles, their opposite group of muscles, they will become weaker. There's an imbalance in the muscles. So, all those leads to these kind of problems.
Yeah.
Diagnosing the condition, I would add to that, diagnosing the condition that is leading to the back pain is very, very important. See, if it's a back pain, which is like, it's like because of a positional, you slept in a wrong position or something, that's understandable. But something which is occurring over a period of time, repeatedly, you need to get to the diagnosis of the pain first.
Underlying problem.
Underlying problem. Once having diagnosed what is the condition, thereafter you address it. Right? So you need to come to the diagnosis importantly, and that is where I mentioned in the beginning also. So minimally invasive intervention. With a minimally invasive intervention, you take care of the pain part of it. Once you are comfortable with the pain, you can go ahead and do the exercise.
Yeah.
Right? So that is what it enables you to do.
Okay.
So getting back to that regenerative state, or getting back to a state where how you were in a healthy posture, is where it gets you to.
Correct. A question from Venkat Natarajan has been already answered by Dr. Renu. What about body's natural mechanism to handle pain? Shouldn't we give it time to recover before starting medications early? I think that has been addressed by Dr. Renu. And we'll move on to the next. Usha Sridhar. What about arachnoid cyst? I hope I'm pronouncing it right. Does it have a tendency to grow and cause pain? Usha Sridhar has asked the question.
Yeah, arachnoid cysts can be significant cause of pain. There are incidences of arachnoid cysts, though it's not very common cause of back pain, but there are chances that an arachnoid cyst can be a cause. Again, you need to come to the diagnosis of it. Most often it is clinically, patient presents with a radicular pain. If it is close to it definitely comes to nerve pain.
Okay.
said that once you do your examinations and you have a radicular pain, go ahead, do your MRI. Once on the MRI, you have an arachnoid cyst, you can go ahead and again with minimally interventions, you can target this.
Okay. So is there any SS Veena has asked that question? Why can we say that backache cannot be treated at all? Have we ever has any patient faced that back pain cannot be treated?
There's a rare entity, not rare I should say, but lesser rare entity which we call as failed back surgery syndrome, where a patient has a chronic or an acute back pain, underwent a surgery, has undergone an extensive surgery, and even after that may not get pain relief. It could be two reasons leading to it. One, the diagnosis was wrong, or the operation has been performed altogether on a wronger level, or it was a wrong diagnosis that your surgeon has decided upon. And that could be significantly, your pain generator could be somewhere else, and that was not addressed in the surgery. So that can lead to a prolonged period of pain even despite the surgery. Second is, the surgery was done correctly for the reason that it had to address. But thereafter, in the post-operative period, there is a chance of developing adhesions in your epidural space. So this is also a significant cause which comes to us as failed back surgeries. So these are the group of patients which will have a very, very chronic phase, bad back pains, rather difficult pains, but we can again address them with neuromodulation. We can put spinal cord stimulators, we can do pulse radio frequency of the dorsal root ganglion. They are also addressable, and we can get significant pain relief.
Okay, thank you. Savita Guruprasad has a question. When is alternative heat and cold packs? Alternator, is it recommended at all? Or when is it recommended?
No, it's not.
It's not recommended. Okay.
No.
So it's either hot or it's cold, depending upon the condition, right?
Yes, yes.
Okay. I think you answered that question earlier with the examples. There is a question here. My dad went into coma, for which doctors doubted as some problem in the spine, as he was on a neck collar before admission, and he went to sleep with a neck collar. Can that happen?
Sorry, can you just elaborate on that question?
Yeah, I think Maithili, you need to ask more about it. Otherwise, we cannot answer. Dr. Malavika Mitra has said, I have developed lower back pain after recovering from COVID. So today's session is very helpful. Okay, we have covered that back pain and COVID. So we have a lot of messages commending both of you. Thank you so much. And spray or cream for pain relief. Those sprays are there and cream. I think it's up to you, right? Whichever.
I think I would add to that. The very important thing over there underlying is you have these sprays or creams, right? So there are different kinds of sprays or creams that come with. There are certain sprays which come, they have absolutely nothing apart from that. They just act as a coolant. So it's like you have a lot of receptors in your body. And it works on the principle of gate theory of pain, wherein you have certain receptors which carry the pain sensation and certain receptors which will carry the cold sensation or pressure sensations. So it's just like, these sensations, you're just stupefying them.
Yeah.
So you just stimulate something and your body gets totally, you mislead the brain, and it does not perceive the pain sensation at all. So those kind of things work well with that. Creams and lotions or ointments, again, there are some which are herbal preparations which use menthol and bases and all like that. There are some which have even other medications like gabapentinoids, which are like anticonvulsants and all. I don't know if they really have any role to play. There are not a lot of studies which are taken on that. So I really don't recommend those. They have real much benefit. But the other ones, there are some certain conditions like which are treated with lignocaine based ointments. They are very effective for neuropathic conditions like herpetic neuralgia, especially in the back if it is involving, or thoracic chest region and all. It's actually a gold standard treatment for that. That's the first line of choice for that. So those conditions can be very well taken care with 5% lignocaine creams and all. Others barring, I would really recommend to stay away from using prolonged use of preparations which include your diclofenac and all. So
Prolonged.
these, yes, it's a myth that people think that, diclofenac, if we are taking rectally, rectal suppositories, or if we are taking the local applications, they're not harmful. No, the truth is, eventually the drug gets into your circulation. It will go through the metabolism that it has to go through from the kidney and the liver. So it will cause whatever has to be caused, or whatever side effect it has, whether you consume it orally or you're taking it IV or you're taking it in the local form.
So it does, okay. Is wearing a belt advised during long journeys? If not, how to manage radiating pain during long journeys? Loga Sundari has asked this. Some people advise for wearing a belt for low back pain during a long journey. Is it okay?
See, first and foremost, it should be, the low back pain should be addressed, and the help should be, you should seek help from a doctor, and wearing a belt is not an option. I mean, for short term, absolutely fine, you can wear it. You're preventing the further damage, like especially when you're traveling and all that. But I do discourage in patients, for a very, very long term use. It can be used, for a week, for 10 days, but prolonged use is definitely not required. I mean, it's best to seek help and just get to the problem. Why is the first of all, why are you wearing the belt? And if that can be sorted out, your problem can be sorted, then, there's no need to wear a belt.
So I think we have covered all the questions. There are some repetitions. I think doctors have already answered those questions, so I'm not dealing with that anymore. And one question, I think, about 8 walking, that is one big, I don't know whether it's effective or not for hip pain, the walking as in the formation of 8. Even in some parks, they have that 8, and people tend to go follow that 8 and come back. Is it effective?
No, I don't see the logic.
You don't see the logic, okay.
No.
So just walk, don't lead a sedentary life, just walk, that is enough. Okay, thanks. Thanks a lot, Dr. Renu and Dr. Swati. I think it is time to bring Jay Srinivasan, founder of RedMed, to come and give his closing comments. Jay?
So much. Meghu, he has delegated the job to me.
Oh, so, Sandy, Sandhya, please come in.
Yeah, so
I hope your video is on.
Yeah. So thank you so much. For me, this has been quite an interesting and informative session, and 4 major takeaways. One is the posture, having healthy postures, ergonomic postures, not sitting for more than half an hour at a time, which we just did. So I will soon after this walk around, not lying down with a phone or a book, putting pressure on the back. So that is one main thing. Second is about exercise. It doesn't matter what you do, but be consistent and disciplined, and even if it is for 10 minutes, just make it a habit to do that. The third one is a back pain could be caused because of many reasons, and one should try and meet an interventional specialist at the earliest. The earlier, the better to treat it and make sure that you don't get into surgery. So that were 3 main things. And of course, thank you so much for answering all the other questions patiently, Dr. Renu and Dr. Swati. Such a pleasure to have you with us today. Meghu, as always, a very good host, moderator. Thank you, LBN, and all ladies league for hosting this session along with RedMed Health Systems. And of course, all our audience for being with us here today and being with us at every other session. Meghalay, over to you to announce the next session, which will be on the 26th of June, the last Saturday of June.
Yes, thank you. Thank you, Sandy. That was a nice summing up. And as always, every last Saturday of every month, please mark your calendars for the next Healthcare Insight session, which will be on Elder Care by Dr. Tanga Prabhu, June 26th, Saturday. And thanks, Dr. Renu and Dr. Swati, for sparing your valuable time. I know how difficult it is to get away from work, busy doctors, but this was a fantastic session, and we did bust a lot of myths, which is my aim of conducting this Healthcare Insight.
Thank you so much for having us on the platform. Thank you.
Thank you.
Bye-bye.
So participants, please like the YouTube channel. With the link is there. The recorded version and the recording of this event will be there on YouTube soon. You can check it out because so many interesting tidbits we need to go back, revisit, and understand again. So please like our LBN Tech Solutions Facebook page for more events. And participants, as usual, thanks for making this event a great success, and thanks for the wonderful questions which you asked. And see you all last Saturday of June for another session of Healthcare Insights. Have a lovely evening. Thank you.